Have you ever wondered how anesthesiologists ensure a patient's airway remains open during ENT surgery? It's a question that underscores the importance of an often overlooked yet crucial aspect of these procedures. The key lies in maintaining an open airway, a task that comes with its unique set of challenges and solutions. One such solution is jet ventilation, an innovative and effective method used to ventilate patients during ENT surgeries. This technique uses high-pressure gas to maintain airway patency, providing a lifeline for patients under the knife. It's not simply about keeping the airways open though. Jet ventilation plays a pivotal role in ensuring patient safety and the successful completion of the surgery. Through its careful and controlled application, anesthesiologists can monitor and manage the patient's breathing, preventing complications and ensuring a smoother surgical process. Without jet ventilation, ENT surgeries would be far more complicated and risky. So, how does jet ventilation work in ENT surgery? It all starts with induction. Induction is the initial phase of establishing jet ventilation, and it's a critical step in preparing the patient for the procedure. This phase is all about creating the optimal conditions for a successful surgery, and that involves a few key elements. First, the patient is administered anesthetics. This is a crucial part of the induction process, as it allows the patient to relax and be comfortable throughout the surgery. Anesthetics are administered in a controlled manner, ensuring the patient's safety and comfort at all times. The type and amount of anesthetic used are carefully chosen based on the patient's health status and the specific surgical requirements. Once the patient is sufficiently relaxed, the next step is the placement of the jet ventilation catheter. This catheter is a small, flexible tube that is inserted into the patient's airway. It is through this catheter that the jet ventilation is delivered, providing oxygen and removing carbon dioxide from the patient's lungs. The placement of this catheter requires precision and expertise to ensure it is correctly positioned for optimal ventilation. Now, during this induction phase, several factors are considered. The patient's overall health status is of prime importance. Any existing health conditions or potential complications are taken into account when preparing for the procedure. The surgical requirements are also a key consideration. The type of surgery, its expected duration, and the specific needs of the procedure will all influence the induction process. The induction phase is a delicate balance of ensuring patient comfort, maintaining safety, and preparing for the surgical procedure. It's a critical step that sets the stage for the rest of the jet ventilation process. Once the patient is induced, we're ready to move on to the next phase of jet ventilation. This is when we transition into the maintenance phase where the patient's ventilation is carefully managed and monitored throughout the surgery. But that's a topic for our next segment. For now, remember, a successful induction is the first step towards a successful ENT surgery using jet ventilation. With the patient induced and the catheter in place, we can now maintain the jet ventilation. The maintenance phase of jet ventilation is an essential part of ensuring the safety and comfort of the patient and the overall success of the ENT surgery. It's during this phase that anesthesiologists truly showcase their expertise, their precision, and their ability to adapt to changing circumstances. Let's dive a little deeper and explore how this process unfolds. Once the catheter is in place, the anesthesiologist begins to deliver high-frequency, low-pressure pulses of air into the patient's lungs. This is the crux of jet ventilation, but delivering these pulses is not a set-it-and-forget-it situation. Oh no, it's a dynamic process that requires continuous monitoring and adjustments. The anesthesiologist keeps a close eye on the patient's airway pressure and oxygen levels. These parameters are crucial for maintaining a safe and effective ventilation. The airway pressure must be carefully controlled to prevent barotrauma or injury caused by increased air pressure. Similarly, oxygen levels must be kept within a safe range to ensure the patient's tissues receive enough oxygen. To achieve this, the anesthesiologist adjusts the frequency and the pressure of the air pulses based on the patient's response. If the airway pressure is too high, they might lower the frequency of the pulses. If the oxygen levels are dipping, they might increase the pressure. Every patient is different, and so the anesthesiologist must be prepared to adapt their approach accordingly. But it's not just about the numbers. Anesthesiologists must also be vigilant for signs of complications, such as changes in the patient's heart rate or blood pressure, or visible signs of distress. These signs could indicate that adjustments are needed to the jet ventilation. This continuous monitoring and adjustment is what ensures patient safety and surgical success. It's a delicate dance, a balancing act of precision and adaptability. Though it may sound complex, the maintenance of jet ventilation is a meticulous yet manageable process. With the right knowledge, skills, and experience, anesthesiologists can navigate this phase with confidence and grace. The surgery is complete, but our work with jet ventilation isn't over. Now we move on to termination. You may think of termination as simply the end, but it's so much more than that. It's the final act of an intricate ballet, ensuring that our patient leaves the operating room in the best possible condition. So, what exactly does termination entail? Well, it involves safely removing the catheter and making sure the patient's airway is functioning normally. This is no less important than any other step in the process. The catheter, which has served as a lifeline delivering oxygen directly into the patient's lungs, must be removed with utmost care. Any rush or misstep may lead to complications, which we definitely want to avoid. Now, this isn't just about pulling the catheter out and calling it a day. It's a step-by-step process, designed to ensure the patient's safety. Once the catheter is removed, we need to confirm that the patient's airway is clear and functioning normally. This is where our training and experience as anesthesiologists come into play. Our vigilant monitoring of vital signs continues, ensuring that the patient's oxygen levels, heart rate, and blood pressure are within the normal range. But what if they're not? Well, that's where we step in, ready to provide supplemental oxygen if necessary. We're prepared for every eventuality, always keeping the patient's well-being at the forefront of our minds. This is where our knowledge, skills, and attention to detail truly shine. Termination may be the end of the jet ventilation process, but it is by no means a passive phase. It requires active involvement, careful observation, and timely intervention. So, as we come to the end of this phase, remember that each step, from induction to termination, plays a critical role in the success of the procedure. Termination is a critical step in the jet ventilation process, marking the end of our active involvement in the patient's breathing. But remember, our ultimate goal is always the same: ensuring the safety and well-being of our patients, from the moment they enter the operating room to the moment they leave. Jet ventilation in ENT surgery may seem daunting, but it's a vital tool in the anesthesiologist's kit. Let's jog our memory a bit, shall we? We've delved into the nitty-gritty of jet ventilation, a key component in ENT surgery. From the initial stage of induction, the steady maintenance phase, to the final termination stage, each step is crucial, and the anesthesiologist's role is paramount. So, what exactly have we learned? Let's start from the top. Induction, the first step of jet ventilation, is where the anesthesiologist skillfully introduces the patient to a state of unconsciousness. This is done using specific medications and techniques tailored to the patient and the surgical procedure. The importance of this phase cannot be overstated. It sets the stage for the entire surgical process and ensures the patient's comfort, safety, and stability. Next up, we have the maintenance phase. This is where the jet ventilation really shows its worth. The anesthesiologist adjusts and maintains the ventilation to keep the patient's oxygen levels within the desired range. It's a delicate balancing act requiring constant vigilance. The anesthesiologist must respond promptly to changes in the patient's condition, making adjustments as needed to ensure the patient's well-being while the surgeons do their work. Finally, we arrive at the termination phase. This is when the anesthesiologist carefully brings the patient out of the induced state of unconsciousness. It's a gradual process, ensuring the safe removal of the ventilation and the steady return of the patient's natural breathing. Like the other phases, the termination phase is critical. It requires the same level of skill, precision, and constant vigilance from the anesthesiologist to ensure a smooth transition and recovery for the patient. Throughout all these phases, the anesthesiologist's role is pivotal. They are the guardians of the patient's safety, ensuring that the patient's oxygen levels are maintained within the desired range, responding promptly to changes in the patient's condition and ensuring a smooth recovery post-surgery. But why is jet ventilation specifically so important in ENT surgery? The answer lies in the nature of the surgery itself. ENT surgeries often involve the upper airway, making traditional ventilation methods challenging. Jet ventilation provides a solution, allowing for a clear surgical field while still ensuring the patient receives the necessary oxygen. It's a testament to the ingenuity and adaptability of anesthesiology, tailored to meet the unique demands of ENT surgery. So there you have it, a recap of the key takeaways from our exploration of jet ventilation in ENT surgery. From induction to termination, each phase is critical, And the anesthesiologist's role is instrumental in ensuring patient safety and surgical success. Jet ventilation is a testament to the intricate and fascinating world of anesthesiology, ensuring patients can breathe easy during ENT surgery.